It's not the first time the United Nations is sounding an alarm about the ongoing Ebola epidemic. However, it's the first time a UN agency has raised concerns about the impact the crisis is having on children. UNICEF says at least 2,000 children have been orphaned as a result of the crisis.
So we're starting to see all the secondary levels of the impact of this historic disease of historic proportions, really. And what it means for UNICEF, what it means for all the other agencies involved, is that we have to be extremely creative, extremely courageous, and very nimble to try and keep ahead of this, because it is outfoxing us, outpacing us.
UNICEF is fighting a battle on two fronts, tackling Ebola itself and at the same time trying to deal with the disease impact on basic health services such as vaccination programs for children and care for pregnant women. The UNICEF Chief of Crisis Communications, Sarah Crow, who has just returned from 5 weeks in Liberia, says it would be an absolute outrage if large numbers of children died from preventable diseases as a consequence of the epidemic.
There was a real sense in Liberia that the world had abandoned the country because people were afraid to come in. There wasn't the kind of attention. You were literally seeing people dying outside hospitals, and there wasn't that sort of sense of outrage and alarm. I think there's also a sense that it really requires some extraordinary effort.
The organization says there are 2.5 million children under 5 in the areas affected by Ebola. Children face both the direct risk of exposure to the virus as well as secondary risk as a result of the death of caregivers and family members, such as the loss of access to routine healthcare, vaccination, and education. Susan Mwongeli, CCTV.